and introduces one member of the group hosting this dialogue of the Media Task Force of the Eastern and Southern Africa Interagency Working Group for Risk Communication and Community Engagement. COVID-19 vaccination programs are underway by fits and starts throughout Africa, but even when the shots are in supply, there's no guarantee of public demand to get the shot. Social scientists and communications specialists in the region face several challenges in ensuring high demand and uptake of COVID-19 vaccines. Understanding how people think and feel about the vaccine and what social processes influence demand and uptake is at the core of what we call demand promotion work. These efforts are further challenged by wide-scale mis- and disinformation about the science and safety of COVID-19 inoculation. We will have today one keynote speaker talk to us about vaccine demand promotion, and then we'll hear from our own Internews pandemic media mentor, who will provide advice to journalists on how they can report on vaccine hesitancy and ways to counteract it. Before we get to our speakers, though, I'd like to hand the proceedings over to my co-moderator, Tole Niata. Tole is an Internews pandemic media mentor based in Nairobi, and Tole is going to update us on the media community feedback our working group has collected recently. Tole?
Thank you, Wayne. So the RCCE Eastern and Southern Africa partners have a feedback mechanism across the region. So what happens is the partners collect concerns and feedback from communities, and it is from this feedback that we choose the topic of discussion in this media dialogue. So for this round, what we are getting from the ground is the following. COVID is real, but the vaccine has a chip with 666 effect on people to turn them to satanism. That is why we're refusing to go for the vaccine. This was heard in Lesotho and Malawi. COVAX has so many side effects. I prefer J&J. Unfortunately, it hasn't arrived yet. This was heard in Kenya and South Africa. The vaccine is making people sick. The people that have gone to get the shot are getting unwell. They are talking about side effects. They're saying, God is my vaccine. This concern was heard in Kenya, Malawi, Lesotho, Mauritius, and Seychelles. I would rather die of another cause, not from blood clotting resulting from the vaccine. This was heard in Kenya, South Africa, Malawi, and Zimbabwe. If COVID-19 vaccine had been there in time, most likely Dr. Cindy, as a healthcare professional, would have likely been vaccinated and her life saved. This is the true cost of incompetence of our leadership. I'm sad and angry at someone so loving and so selfless is gone. This was a complaint had in South Africa. Next, please, Christoph. So more rumors, observations, and beliefs. From Kenya, Rwanda, and Mauritius, they are saying, we are getting reports that people that are going to get the vaccine, that are being vaccinated, others are getting sick. Why is a person who has been vaccinated, somebody is asking why a person who is vaccinated is getting infected. This is a concern from Kenya, Rwanda, and Mauritius. Somebody is saying from Rwanda and Kenya, COVAX vaccine will aggravate non-communicable diseases like blood pressure, diabetes, and others. And somebody from a concern from Kenya is, if I refuse to be vaccinated with my family, will the government arrest us? This is a question from Kenya. And then from Lesotho, there is a high demand for COVID vaccines as people are eager to get vaccinated for fear of cross-border infections from the neighboring South Africa provinces. And there's also concern, people are saying, so the contraceptive the contraceptive is a chance of getting clots is 1 to 1,000, as compared to AstraZeneca, which is 11 to 1 million for under 30s. But the governments seem to be worried about AstraZeneca. People are wondering why the government seem to be so worried about AstraZeneca, where the risk is 11 to 1 million, while they don't seem so worried about contraceptive pills, where the risk is 1 to 1,000. This was South Africa and Zimbabwe. So these are the concerns and feedback that we are getting from the partners across the East and South African region. And from this is where we come up with polling questions, where in the course of the dialogue, my colleague will launch a poll, and thank you in advance for voting. And from the vote, we will choose the next topic of discussion. Thank you very much for listening. Back to you, Wayne.
Thanks very much, Tole. So you can see from the rumors that get circulated, what a challenge it is to convince people that they must get the vaccine, that it is safe and will save lives. So it's a big job to produce this kind of demand in something like a COVID-19 vaccine. Helena Ballester Bon is a communication for development specialist at the UNICEF Eastern and Southern Africa Region Office in Nairobi, and she's current chair of the ESAR Technical Working Group on Demand, Risk Communication, and Community Engagement. This group contributes to the regional efforts to successfully introduce COVID-19 vaccines in Africa. Helena will discuss the stages and strategies of promoting vaccine demand and uptake, and she will address the role played by misinformation in limiting demand for COVID-19 vaccines in the region. While Helena is speaking, please feel free to type any questions you have in the chat box, and we will get to as many of these questions as we can during the hour. For now, Helena, welcome, and over to you.
Thank you, Wayne. Sorry, I was trying to find my way. Can you see my screen?
Yes.
Yes, okay, fantastic. In full screen mode, correct?
Let's see now.
Just
full screen mode. Yes, I see it in full screen.
Okay,
and,
fantastic.
Yes.
Fantastic. Well, thank you very much for inviting me to this media dialogue. I'm very pleased to be with you today. As Wayne was saying, I'm going to be talking about how journalism can support the vaccine rollout in Eastern and Southern Africa countries. So, just to mention the previous presenter, he was providing some anecdotal rumors, but also some really legitimate questions that are circulating either offline or online. And it's interesting to see how they align with the different findings we have from research and polls that we've been conducting in the region. So just to provide an overall picture, in the different countries in which we've done research and polls, what we see is a large majority of people. Normally it goes between 60% and 70% of the population who are willing to uptake the vaccine. Then we have around 25 to 30% of the population who are hesitant. So hesitancy, what means is that people, despite the service being available, they tend to delay the use of the service. And this can be caused by many reasons, but mostly what we are hearing, both online and offline, are questions about eligibility. So whether the person will be eligible to receive the vaccine, given that the number of vaccines is limited and certain priority population groups have been prioritized. Others, questions around trust in the vaccine itself, because it has been developed too fast. for example, but also very logistical questions such as where can I get the vaccine and when I will get it. A lot of questions on adverse effects and safety of vaccines. Then there are some questions in some countries, for example, that are thinking about whether they have to seek medical advice before taking the vaccine. This is something that is very much in vogue right now on social media. And fourth and foremost, whether your family and friends are getting the vaccines, because we need to understand that vaccination is a social process. So we will tend to get vaccinated if those who are around us are also getting vaccinated and expect us to do so. There is a common trend on all these questions and concerns that people are legitimately sharing. And is that all of those, if they are not answered in a timely manner, in a reliable and trusted way, they can have a huge impact on trust on the vaccines, but also on trust on health workers, on trust in the government, in the overall system. So at the end of the day, what journalism can do is to increase these levels of trust. So we know as now that, as Wayne was saying in the introduction, that there is a lot of information circulating both in social media and offline and in radios and so on. And this has been labeled as infodemic. So as you can see on the definition of WHO, is infodemic is when too much information, including false or misleading information in digital and physical environments, during a disease outbreaks causes confusion and also risk-taking behavior that can harm health. And this leads to mistrust in health authorities, and it also can undermine the public health response. This is why it's so important to really keep an eye on that. So infodemic is not something random. In fact, it has been going on because there is an information vacuum on media. By this, I mean that the number of people seeking for information on media, whether online or offline media, is higher than the information that is available. So when you have a gap, someone is going to fill it, and someone is going to profit from this gap. So we need to be cognizant that there is an information vacuum that needs to be filled, and that we need to fill it together so that really the information that is available is actually accurate and the correct one to promote healthy behaviors. I just put this picture in there because I find it very interesting in the sense that the way you frame how you convey the information will lead to a narrow perceptions of what is reality instead of having a larger and informed view of what is going on. So this is where media comes to role. I think there are four main items that journalists should keep in mind when dealing with the COVID-19 vaccines introduction. One is to understand the audience. So what are the needs, the questions, the concerns of your audience, and how can you respond to them? The other one is engagement. Like one direction communication often is not effective to change people's mind. On the other hand, if we try to install as much as possible two-way communication, this will provide a safe space for discussion where people will be able to share their concerns, their questions, and provide feedback and information that is trusted. I think this is also very important to make your audience feel confident in yourself, because you are the trusted channel, correct? So the more you make them feel confident, the higher the trust in what you are saying is going to be. And finally, to help your audience get answers. And by that, I mean to be informed about the conversations that are ongoing, about the scientific conversations that are ongoing, but also what disinformation or misinformation is circulating. So how can media more specifically support the vaccine rollout? As I was saying, learning about vaccines is essential. And you can do it from appropriate experts. The RCCE network is, of course, one of the leading group that can support you, but also UNICEF and WHO has a large variety of materials that could be used. Also very important to be clear about what is not known, in the sense that this is the first time in history that we are confronted to such a pandemic and such a quick response, and many things are still not clear, not known. We don't have answers for everything. So the more honest we are about it, the higher the trust will be in what we do. Fact-checking information is essential to really alert your audiences of the kind of misinformation and disinformation is circulating, and also checking if what you are about to disseminate is actually correct. So you have Africa Check, which is an independent organization that really does an amazing work in fact-checking. You have the links in the presentation. And Viral Facts Africa, which is a branch of IRA. This is a platform led by WHO in which UNICEF is also actively contributing. And Viral Facts, what they do is to develop content to be disseminated through social media, debunking myths and rumors. So very two handy links here. Also, I think it's important to talk about false balance. So whether you are providing the same space for those who are conveying information that is scientifically backed and those providing information that is not scientifically backed. So I think we need to put into perspective which of these information is entitled actually to more voice in terms of media. As I said before, audience interaction is key to raise concerns, doubts, seek for questions, and also to explore common solutions, particularly at local level. That's very powerful. And finally, I think the media can play a huge role in holding authorities accountable. Governments have the responsibility to protect their population, and I think there is a huge role to play here by media. I wanted also to touch base on a couple of behavioral insights, so how social and behavioral science can help you to increase trust and acceptance and demand for vaccination. First of all, social norms. So as I was saying before, vaccination is a social norm in the sense that you are going to get the vaccine if those who are close to you are also getting the vaccine and you are expected to get the vaccine. As I mentioned before, as per data, the vast majority of people living in Southern and Eastern African countries are willing to uptake the vaccine. So this is the social norm, but this social norm is not being publicized. What you see on media is much more related to misinformation, disinformation, information that can raise fears and so on, rather than really publicizing the norm so that people know what they are going to adhere to. So very important to really put in front that the vast majority of the population is willing to accept the vaccine. Then moral values. So when we understand our audience, particularly at local level, and we understand what are the moral values, and by moral values, I mean, for example, solidarity or protection or respect. Those are key triggers that you could use to really appeal your audience and help them come into the space in which they can promote and also adapt preventive behaviors such as vaccination. Timing is also key. Behavioral and social science has proven that people are most likely to trust and stick to the version of the information they hear first. So be on your marks and ready to really provide the information people are seeking in a way that is timely. Then the narrative. Of course, you as journalism know much more than me about narrative, but framing the conversation and the information you are providing in a way that is close to people, either by using, for example, key influencers, or by using human history story, human human interest stories, and avoiding jargon can really help conveying the message in a way that is understandable, but that also triggers empathy. And finally, the emotions. Often media, they take an approach that tends to trigger feelings such as fear, and those can backlash on the long term. So social and behavioral science, they recommend to evoke constructive emotions, for example, hope or desire to protect people, because those you can create a sense of really personification, of deep connection, and this is what is going to help you reach your audience in the way you are trying to. So reassuring and motivating people to help themselves and others. Do not try to convince people, because often people that do not share your same views will not be convinced, but just by displaying accurate information through trusted sources and providing safe spaces for discussion can really help. So in my last slide, I just put together a list of the different references that I used to put together these slides. They are very useful. If you're interested, you can always consult them and reach to us if you need further questions. And this will be it. Thank you very much. Very happy to answer your questions. Over.
Thanks very much, Helena. There will be more questions a bit later on. I just wanted to touch on something you mentioned in your talk about it is the social norm for people to want to get a vaccine, and yet the news cycle focuses on, problems with vaccines, problems with getting vaccines, and some of these, very, very rare cases where vaccines harm people. It kind of reminded me of the old news adage, when dog bites man, that's not news. When man bites dog, that's news. And this is the conundrum for the journalism industry, I think, is that as journalists, we are looking for stories that will shock our interest or grab the attention of. We cover things that are out of the ordinary because that is actually part of the definition of news. And so I think that increases the challenge for building demand for people to get something that they really want in the first place, when the media coverage doesn't really see that as a pitchable story, if you get what I'm thinking. Do you have any thoughts on that? Do you see there's kind of a clash of the news mindset versus the public health communicators mindset?
No, absolutely. You are absolutely right. And I think it's a very good point. I mean, I think everything comes down to framing somehow. You could frame vaccination as the most revolutionary act ever, as the more individual way of saying, I'm going to protect myself and protect others. And this can be news. So this is why, yes, I see what you see, and I completely agree, but this is part of the role of journalism. What do you want to convey? What is your role in promoting safe behaviors? And how do you want to frame it so that when you convey this information, it has actually an impact in terms of media, of number of readers, and so on. So I just leave it there. Thank you.
Thanks, Kate. Helena, sorry. This is a good segue into our next speaker, who is Kate Thomas. Kate is a pandemic media mentor at Intronews, and a key resource person for the Rooted in Trust project, which is Intranews's global response to COVID-19 and its impact on information provision worldwide. Kate is a writer, global health researcher, and oral historian of epidemics. Kate, welcome.
Thanks so much, Wayne, and thanks everybody for being here today. So I will attempt to follow Helena's excellent presentation with some more specific resources for you as journalists about how to approach all these different aspects of vaccine demand and the uptake story. So thank you for having my slides up there. Great. Okay, so if we can go to the next slide, please. Okay, so the first thing that I wanted to start about talking about is how it's really important and interesting, I think, to understand that vaccine confidence is not just black and white, two different buckets that people sit. Either they trust vaccines or they don't. In actual fact, it's a continuum. It looks something like this. And of course, this is in the shape of a syringe here. But so as you can see from this picture, there are people at the far left side who will typically refuse all vaccines. And on the other side of the spectrum, there are people who will unquestionably accept all vaccines. But the reality is that a lot of people sit somewhere in the middle. And vaccine confidence is not something that's fixed. People can move along the spectrum. When the right conditions are met, when people have greater access to information or are able to address their fears and anxieties, somebody who is vaccine hesitant can become vaccine confident. So it's important to see it this way because I think it helps us understand as journalists how to reach our audiences. And historically, journalists tend to have the best success with reaching people who sit somewhere in the middle of that continuum. It's much harder to share, somebody who's at the far left who is very adamantly against vaccines is going to be much less receptive to accurate data, to knowledge about why vaccines could actually help them, their families, and their communities. But somebody in the middle who isn't quite sure will likely have questions that they're curious about, that they would like to be answered. And that's where I think the power of journalism lies, in helping to offer those people the information they need so they can make up their minds about what to do. And as Helena has said, it's not about persuading people or changing people's minds. None of us have the power to do that. I think we all know how difficult it is to change our own minds about something sometimes. So it's very difficult to do that with someone else. But what we can do is make sure that people have access to the information they need to make the decision that is rooted in scientific data and accuracy. Next slide, please. So explaining vaccine confidence to your audience, there are many different frameworks for understanding vaccine confidence. And so here is one that is described by the Australian researcher Julie Leask, who sees vaccine confidence as a pyramid of acceptance made up of 5 levels. So somebody who refuses all vaccines, going towards the unquestioning acceptor, and you can see those people in the middle, the hesitant person, otherwise known as the wait and see person, who hasn't yet made up their mind. And some of the questions that people who are in that middle category might ask would be, is there good safety data for this vaccine? And what was the efficacy of the vaccine in the clinical trial? And so when you hear those kinds of questions as a journalist, there is an opportunity to respond to them and recognize that the people asking those probably haven't fully made up their mind about the vaccine. And so there is an opportunity to reach them. And some ways to do that, sorry about that. Some ways to do that can be the talk show. If you're a radio reporter, the talk show is an excellent way of addressing those questions. At Internews, we have worked with media organizations where reporters have run radio talk shows and invited experts in part of the vaccine development process, experts from the local Ministry of Health, Health Promotion Department, for example, doctors onto the show to respond in real time to audience questions like these that come up. That's a really effective way to reach your audience and supply accurate, scientifically rigorous information. Next slide, please. Yeah, this is the 3 C's model, which the WHO uses to understand the factors that, that contribute to vaccine confidence. So according to the WHO, vaccine confidence is influenced by 3 main factors known as the 3 C's: confidence, convenience, and complacency. So confidence would be trust or lack of trust in the safety and effectiveness of vaccines and in the health system that delivers them. So that could be trust in research scientists, healthcare workers, or even the motivations of policymakers who make decisions about vaccines. So, you know, and there can be many legitimate reasons why people would not trust the safety and effectiveness of vaccines or the healthcare system. For example, if the healthcare system in the country or area where they live has not honored them in the past, has not delivered the care they need in the past, they're much more likely to be hesitant now about receiving a vaccine at a healthcare center. So many of these reasons are based on historical things that have happened in the past. We've seen this all over the world, where there have been situations where healthcare systems have not won the trust of the people that they're serving. And then down the line, there are these consequences. So it's really important to understand that. The second one is convenience. So that's access, really. It's how easily people can access the vaccine, the degree to which the comfort, convenience, time, location affects vaccine uptake. For example, if a vaccine is only available at an inconvenient time in a really hard to reach location where you have to take several buses and the road is not good, you're much more likely to not go and get the vaccine. And the last one, complacency, that's nothing bad. It just suggests a feeling of security or being unaware of a potential risk. For example, someone might believe they're not at risk of getting a certain disease, or they might consider other issues to be much more important in their life. And again, in sub-Saharan Africa, we can all understand why that might be if people have historically been much more affected by malaria and are now, you know, now there's a big push to get a COVID vaccine. People might feel, well, why haven't I had this kind of health promotion going on for malaria, for example? Who knows? There are many different factors and it really depends on the circumstances for the person. But again, I hope these offer some insight into the psychological frameworks that go on when somebody is more hesitant about receiving a vaccine. Next slide, please. So some common misperceptions about the COVID-19 vaccine that affect vaccine confidence. So the first one is mistrust of speed of COVID-19 vaccine development. This is something I hear a lot. People say, well, the vaccine was developed so fast, so how can it be trustworthy? So it's important to recognize that as a world, we are accustomed to slow vaccine development. For example, it took more than 30 years of research and development to create a vaccine for malaria, which is very recent news. Decades of effort have been invested towards developing a vaccine for HIV, and there's still further to go. The only real comparable example of quick vaccine development related to sub-Saharan Africa is that of the Ebola vaccine, which took less than 3 years before it went to clinical trial. The mumps vaccine was developed in 4 years. So, you know, given this context, it's really easy to understand why there is public skepticism about the shortened time frame of the COVID-19 vaccine. However, you know, one of the good analogies that I like to use here is the traffic light analogy. Imagine driving down the road in your capital city and finding all the traffic lights stuck on red and you're just waiting and waiting at the light. And this is often the norm for vaccine scientists. There are a lot of holdups along the way. But in a major pandemic like COVID-19, the lights are more likely to be green and the timeline is faster because it's a worldwide emergency. And so the problem is not really that the vaccine was developed too quickly. It is in fact that other vaccines have been developed too slowly. And so it's important to understand that when you're facing questions like, why was the vaccine developed so fast? The second one here is a misunderstanding of causal relationships. So this is something that comes up a lot in your work as journalists, where, you know, if something happens, if one event happens on the same day as another event, people will often think that there is a relationship between the two of them. For example, if somebody gets very sick the day after they receive the COVID vaccine, there can be rumors that the COVID vaccine caused their sickness. Well, those two things, just because they happened in a similar time frame, does not mean that they are necessarily related. So that's also important to be aware of. Next slide. Yeah, misinformation. I won't go too much in depth about this because I know Helena covered it and we've talked a lot about this in previous seminars, but you know, misinformation, of course, is a key trigger of vaccine hesitancy, especially among people who, if you think back to that spectrum we talked about of vaccine confidence, among people who are in the hesitant or wait and see category, people who aren't quite sure. So somebody who is unsure about vaccination, imagine them now hearing a horrible, untrue rumor about the vaccine. Because they're already worried, their myths and rumors and other forms of misinformation might convince them to not get vaccinated. But that same person who isn't quite sure, if they hear accurate information or stories, relatable human stories about success with the vaccine, about positive experiences, about cases being prevented, then they could swing to the other side of vaccine confidence. So it's really important to recognize the power that you have as a journalist in choosing the kinds of stories that you share and in really rigorously fact checking, which I will move on to in this next slide, please. Yeah, so important to fact check and correct rumors, but also to acknowledge the reasons why people may believe in them. Telling people they're just wrong and they don't know what they're talking about, it doesn't work. It just pushes them further away, and it really increases the possibility of them becoming defensive. You lose people when you move into shame and judgment, unfortunately. So I think that a really good approach is to acknowledge why somebody may believe in a rumor and then address it with accurate scientific information. And there are a couple of examples here on the screen. Next slide, please. Maximize the power of human stories. This is really important. This is something I've seen a lot of among people recently who have expressed hesitancy about getting vaccinated. The things that I'm noticing that are changing people's minds, yes, scientific data helps, but really it's human stories. It's when somebody has decided they won't get the vaccine or thinks they probably won't, and then they hear that all of their friends were vaccinated and it went well. You know, there were some side effects, but mostly it went well. They decide they want to travel. They realize they may need to get vaccinated to travel. They hear from other people that actually it wasn't a big deal, that it wasn't as bad as people were worried about. It's those human stories that I'm noticing that really reach people. So numbers are compelling, but a story that really digs into those human feelings about receiving the vaccine, about what it means to us as humans, are really very effective. So I would advise you to make your content concrete, supply a narrative, and provide value. If messages are not concrete and don't include stories, our brains will try to make sense of that gap and fill the abstraction with stories and ideas that make sense instead. So human stories really, really contain a lot of power. Testimonies are also really another good way. They can offer meaningful insights into someone's personal experience with vaccines. For example, one thing you could do would be to interview somebody who initially was hesitant about getting vaccinated, but later changed their mind. You could do a first-person narrative or a radio interview with that person to show your audience the process they went through and the factors that informed their decision about changing their minds and getting vaccinated. That kind of story would likely resonate with people who are also feeling that same way and address their concerns while also empathizing with them, which is really powerful. Next slide, please. Work with trusted public figures. Yeah, this is also another really effective way of reaching people. The case study I've put up here on the screen is how Elvis Presley inspired confidence in the polio vaccine in 1955 in America. The vaccine had a high efficacy rate and would save many thousands of lives. However, in the initial weeks and months following its rollout, the majority of those getting vaccinated were children, and many teenagers and adults falsely believed they were not at risk from polio, and uptake among that group was low. So going back to that complacency, part of the 3 C's that WHO talks about. So Elvis was rocketing to stardom, and he was asked whether he would consider getting vaccinated on live television, and he said yes. And within 6 months, polio vaccination uptake among American teenagers, who made up his big fan base, had jumped from less than 1% to more than 80%. So thinking about who are the trusted figures in the communities that you work with, is there ways in which you could interview them about their experience getting the vaccine? You know, those stories can be really effective as well. Next slide, which is my next to last. Some more tips on reporting during times of vaccine hesitancy. Yeah, so the first one, balance voices and perspectives. So if, for example, there is a lot of vaccine hesitancy happening in the community where you work, if you interview people about who have beliefs about, you know, that relate to vaccine hesitancy, it's always good to balance that story with a belief that, or an interview with somebody who can speak to the efficacy of the vaccine, the safety profile of the vaccine. An example, you know, I know there have been some small protests in some parts of West Africa relating to the vaccine. If you're covering stories like that, make sure that you also balance that out with a voice from the Ministry of Health or a doctor, another clinician who can speak to the other side of the story. Lots of vaccine experts out there, medical anthropologists, also great, other social scientists you can speak to. The next one, address the side effects. Yeah, don't gloss over those. I mean, there are side effects that people will experience. It's important to report on them accurately. So I like to call it a friendly fever and helpful headaches. You know, yes, there can be fevers and headaches as a side effect, but these are designed to help people. They are not designed to make people sick. So important to speak to that. Third one, approach the unknowns with confidence. Yeah, and this is just really a key thing to remember in all reporting about health and science. There are things that are unknown, and if you don't know things as a journalist, you know, say somebody asks you a question in a talk show and you don't know the answer, it's important to say, you know, that we don't have information on that, but here is a resource for where you could access that. And just jumping to the last one here, access reliable sources as needed. It's really important. So it's really important to build out a, you know, you could have this organized as a spreadsheet or however you'd like to organize it, but a list of sources that you use and that you can refer to when there are things that you don't know that come up in the context of vaccine reporting, because there will be. And it's important to know where are the trusted sources that you can go to, which are the websites you can use. And I will speak to that briefly in just one moment. Using language mindfully, really, really important, because sensationalist language, of course, can help to fuel vaccine hesitancy. So really being very careful about the words that you choose. Of course, this is something that you all think about every day as journalists, but just to kind of reiterate that one, because very important here. And bringing that into the context of headlines, sensationalist headlines, as tempting as they can be, sure, they can be compelling, but they may fuel vaccine hesitancy. So really, really important to represent the story as simply and accurately as possible, even if that means your headline has to be slightly longer and less catchy. At the end of the day, this is journalism in service of helping to save lives, and that is really, really key. So the last slide, please. Yeah, so more resources. So, and I will share this with everybody, but so here are some links to resources and sources that you may find useful while reporting on vaccine uptake and demand. So the Internews COVID-19 page has a COVID-19 glossary that's quite useful, I hope. First Draft News, another one, is fantastic on reporting on emerging health and vaccine misinformation, and several others down there, including the WHO YouTube COVID-19 vaccines page, which includes some explainers. And I can't end this presentation without giving a shout out to the Internews Let's Talk Vaccines course, which I will be putting a link to in the chat, which we just launched this week, which is a really comprehensive course on how to cover vaccine reporting as a journalist. It's completely free. You will get a certificate at the end of it, and it includes everything from the science, access, and logistics of COVID-19 to how vaccines are made. All of your burning questions about how vaccines are made, what are the ingredients, how are they distributed, what's the supply chain like, what are the clinical trials look like, all the way to vaccine confidence, and really exploring this issue, which I've talked a little bit about today in depth, are contained in this course. I may be a little bit biased because I was part of the team that helped create it, but I think it's fantastic. We've had some really great feedback so far, and I hope you will consider checking that out, because it's really a strong resource in supporting your reporting and answering any questions that you have that come up around this. So I will end there, and I know we have a few minutes for questions.
Thanks so much, Kate. That was wonderful. Yes, we do have questions from our journalist participants today. But first, I will hand over again to my co-moderator, Tole. He wants to talk to us about a new poll we have for journalists. And then after that, we'll definitely spend the rest of our hour fielding the questions from the journalists on the call. So Tole, take it away.
Thank you, Wayne. So as I told you earlier, my colleague Christophe will launch a poll. Thank you for taking part in this. This will help us choose the next topic of conversation. As we are voting, we already have questions in for our panelists. So the panelists should be prepared. I will read the questions that we have. We have a question from Rita Nyaga. Her concern is the expiry of vaccines, and there are stories that some countries are going to transfer some of the doses that they had been given from the COVID facilities. Case in point, we are hearing Congo was to give away 1 million doses, and they might come to Kenya because of low uptake. She would like a discussion around that. We also have a question from Gabriel from Tandaza FM in Western Kenya. Is asking about the ingredients of manufacturing the current vaccines. I've seen Helena has put some links in the chat, but it would be fun if we could get answers to that. And secondly, he asks, as a radio presenter who interacts with audiences every day, how can you advise me to help my audience either to support or oppose the proposal from the Ugandan president that Africa should manufacture their own vaccine? We also have a comment and question from Sarah Mawere. He said, good day, my name is Sarah Mawere, a broadcast journalist in Kampala, Uganda. I work with UBC. I'm sure radio can reach almost every indigenous tribe in Africa. This is true in Uganda, where radio is used for civic education promotion as appropriately as possible. However, in Uganda, the technical people do not consider radio for local languages as important. They opt for newspapers and TV, where they sponsor programs with huge sums of money, yet majority of the people listen to radio, which is still cheap and affordable. How do you advise us as radio journalists? Also, there's a concern, we lack financial resources to package good educative programs on COVID-19 vaccines. Yet issues of misinformation are affecting the rollout of vaccines in Uganda. So also that is how the panelists are going to advise her to deal with the situation. I'm seeing Lilian Kaivilu is saying, when reporting on vaccines, how do we remain objective? How do we draw a line between objective reporting and advocacy? That is a question from Lilian Kaivilu. So those are the questions for the panelists. Once Christophe ends the poll, you'll be free to pick it up. We have a hand from Charles. Charles, if you can please maybe put the question on concern on chat, that would be grateful. Thank you.
So that's a lot of questions. Helena and Kate, would you like to tackle some of them?
Kate, should I go?
Sure.
A couple of them.
Yeah.
Okay. Apologies, I was briefly disconnected, so I cannot see the questions written, but I'm gonna try to remember those, and if there is anything pending, feel free to ask again. So the issue on expiring vaccines is now very much on vogue. People are discussing about it. And I put on the chat a link to an explanation about safety of expired vaccines. You can access more information on viral facts, and please disseminate it. Those are very useful resources. What is going on now is that certain countries, such as our DRC, are not able to use all the vaccines they have received. And as you know, we are now facing a shortage of vaccines, meaning that there are more people that should be vaccinated than vaccines available. So of course, in those vaccines that cannot be used in one country, will be, in agreement, of course, with all the countries involved, distributed to other countries that are in need of vaccines. It has to be very clear that these vaccines are not expired yet at all. In fact, the movement from one country to another is to really avoid the expiring of vaccines, because they are so precious and they are so few that we are willing to maximize vaccination uptake as much as possible. So this has to be clear, I think. There was this question on the African capacity to produce vaccines. I shared a WHO article on the chat that clarifies this. I'm not sure whether you need to support or not the Ugandan authorities. I think your role is to really convey the adequate information, which as of now, there are very little countries that are manufacturing in Africa. And this, because of the volumes that we are managing, is not enough. So as of now, right now, on an immediate way, it's not possible to do it. But I would rather focus on really conveying the information rather than supporting or opposing a political figure in your country. There was a question on Uganda, how misinformation was affecting vaccine demand and uptake. According to our data, misinformation plays a role, of course, but the concerns that are being shared are much more linked to the safety and efficacy of the vaccines, to the fear of adverse effects following immunization, and then to unknowns about who is going to be vaccinated, when and how. So instead of trying to counteract information, I think what you can do is to really promote and disseminate information around these questions that your audiences are asking: vaccine safety, efficacy, adverse effects, eligible population, where and when to access them, so that there is no information vacuum, so that really people will check and have answers to their specific questions in a way that is accurate and through a trusted source. Thank you very much.
Thank you, Helena. Kate, before you take that, I want to put you on the spot. There are a couple more questions. So in the interest of time, I would like you to bundle them together. So a very interesting one from Ghana. They said, just wanted to emphasize on the point of responsible reporting, given an example of a headline I saw in the newspaper. Says Ghana to receive 350,000 expiring COVID vaccines, knowing the current situation around shortages and the need for countries to share limited stock instead of wastage, what would have been the best and fair headline for this? And the last question, Katie says, hello there. As a radio presenter, I've had my audience say that they ain't ready for the vaccine. How can we get to encourage them to go to the vaccine once it's available? That's Deborah Mwanya from Radio Dhome, Kitui, Kenya. Kate, to you.
Thanks, Tole. And yes, I agree with everything that Helena has said about these as well. So let me just speak first of all to Gabriel's question from Western Kenya. How can you advise me to help my audience either support or oppose proposal that Africa should manufacture her own vaccine? Well, I think it's not necessarily about either supporting or opposing, but discussing, right? So really facilitating balanced discussion, inviting diverse voices into the conversation and diving into the issues. I don't think, somebody else asked a question about that line between journalism and advocacy. It's a great question. It's something that challenges journalists all the time. I'm not clear that I have a very precise answer for it, but I do think that the key to that is balance and including. That's the beauty of journalism, that you can include diverse and balanced voices in your story and show all sides of the story, but make sure that those stories, the key thread in that is the accurate scientific information. And the process for developing COVID vaccines is extremely rigorous. I think many people don't realize exactly what has to happen and the hoops that researchers have to jump through to make sure that their data is absolutely scientifically trustworthy and robust and dependable, and really digging into that and making sure that's the thread in reporting on these things. And so maybe what needs to happen is really more access to stronger resources that do that, and that invite audiences into that space. Because one of the key problems is that a lot of the data is published in, well, it's often in medical journals, which are not accessible to many audiences. And it's often a language barrier too. It's often published in English and Chinese, Hindi, depending on where the particular vaccine was developed, French, Spanish. But if you speak, I don't know, Vai language in Western Liberia, you don't have access to that. You may not have access to the internet. So really it's about widening access and supporting balanced discussions that include scientific data, but also that are conducted with empathy. And I think those are good guidelines for navigating that space between advocacy and journalism, because at the end of the day, the data does speak for itself and does support the fact that these vaccines are trustworthy and reliable and are helping us. So if you are reporting from that perspective, from that balanced place, I think many people will start to come to that conclusion, because the data does show that. What else was there for me to answer? I'm just going through. Yeah, I think I've spoken to these points from Deborah's comments. What can we do to encourage them to go for the vaccine? Yeah, and again, just going back to my presentation on human stories, really, really important. You can interview, for example, a nurse at a healthcare center who received the vaccine herself, who's been giving the vaccine. What was that experience like for her? Those stories are really relatable to people and can help people understand the benefits of receiving the vaccine. I see a final comment here. Great insights on vaccine hesitancy, but the big concern is availability. Yes, for instance, there is a big gap in Kenya, and the government is not helping matters with its ritualistic approach in information dissemination. Will it be safe to mix vaccines for those who fail to access their second dose of AstraZeneca? As far as I know, and I'm not a doctor, but as far as I know, that is something that is not currently supported. It is best not to mix vaccines. Many of the vaccines have different mechanisms, the way they work. So if you took a first dose of AstraZeneca and a second dose of Pfizer, they would work in different ways. So you would not be making a complete full vaccinated picture there. So, no, it's not something that is recommended. Maybe Helena has any thoughts there on those last questions. I'm not sure.
Thank you, Kate. No, I agree with you. I mean, normally it's not recommended to mix vaccines. However, we were talking about the unknown and the importance of sharing the unknown. So it's okay to say that we don't know yet, that the situation as now is what it is. And then we will see. Yeah, I see, Charles, that WHO has issued a guidance on that. I'm trying to find it just to post it on the chat. So that you guys have it handy. Thank you.
Thank you very much, Helena. Thank you very much, Kate. And back to you, Wayne.
Thank you. Thank you, Helena and Kate and Toy. Well, we've come to the top of the hour. I would like all the participants to know that this dialogue has been recorded, and we will share the link. So if you missed some details in Helena and Kate's talks and you want to revisit them to get exact quotes for your stories, the recording will be available for you to go back and revisit all of that. And I'd like to thank the journalists for posing their questions. I think these were some of the best questions we've had in any of our media dialogues. You will see, I believe you see on the screen the results of the polling that we put up today. So this will guide us in designing our next media dialogue, which we will plan to have in the month of June, and we will send notification of this of dates and the details and speakers to you in the coming weeks. And please encourage other journalists you know to join these dialogues. We want to reach as many people as we possibly can with this work. So for now, again, thanks to our keynote speakers, Helena and Kate. Thanks, Tole, for being my wonderful co-moderator. And until next time, I'm Wayne Sharp saying thank you and be safe.
Thank you, everyone. Thank you, Wayne.
Thank you all.
Enjoy the rest of your day. Bye.
Thanks all for coming.
Thank you.
Bye.
Thank you. Bye. Thank you. See you next time.
Thank you. Bye-bye.
Thank you. Bye-bye.